This is Dr. Christopher Sturbaum at Empire Eye Physicians, and we'd like to introduce LASIK surgery on a patient. Here at Empire Eye Physicians, we're committed to offering the latest and safest technology available for LASIK surgery. We perform only laser-guided flap creations and wavefront technology on all our LASIK patients. This allows us to offer the best technology and safest technology for a long-term outcome and improved enhanced vision. Here you can see the laser interface optics is placed on the eye, which allows us to center the pupil on every patient, as well as perform the exact depth of laser cutting that we desire. Once the interface is engaged, the laser treatment only takes 18 to 22 seconds. As you can see here, the laser is generating micro bubbles that cavitate in the stroma that allows us to elevate the flap with simple blunt dissection. So no true cutting is really involved in the laser flap creation, which makes this procedure much safer than the old-fashioned microkeratome cutting. Once the flap is created, the patient is then moved to the Vizx laser and given more anesthetic drops. During this procedure, the patient has very little pain on the cornea. They do feel some discomfort with the eyelid speculum. Here you can see the flap is being elevated with the smooth, blunt LASIK flap elevator and gently prolapsed back. Once the flap is in position, the patient is asked to focus on the orange light that's in the center of the laser beam, and the wave front guided imaging is taken with the iris fixation to allow the best possible centration and axis positioning of the eye underneath the laser. Here you can see high magnification to ensure proper focusing. The lights are dimmed to allow the pictures to be taken, and shortly you will see a light, which is the laser actually firing on the cornea to reshape it to allow the patient to have 20/20 or better uncorrected vision. The wavefront technology is an individualized fingerprint vision measurement, so every patient has their own actual laser treatment, as opposed to the old-fashioned method of using your glasses prescription, which greatly improves your post-operative outcome and reduces the risk of night glare and halos. Once the laser is completed, the stromal bed of the LASIK flap is then re-irrigated and the flap is repositioned and allowed to settle down and seal in place for approximately 1 minute. Post-operatively, patients are given antibiotic and steroid drops to take home. There is some discomfort for the first 4 to 6 hours. However, this is usually tolerated with simply taking Advil or Tylenol and topical steroid drops and artificial tears. The patient is asked not to swim or hot tub for about 2 weeks and be careful for the first 24 hours to not rub or squeeze the eyes vigorously to help prevent any flap dislocations. With the interlace flap construction, flap dislocations are extremely rare, which has been a great benefit and improvement from the microkeratome devices. So depending on the prescription of the patient, 98 to 99% of our patients are able to drive without their glasses, and our enhancement rates are extremely low. Thank you very much for taking the time to view this video, and we look forward to seeing you in our clinic to give you the best possible vision that technology can offer.